Our objective today is to talk about health disparities for Black communities. This has really hit home for me. Our family just went through a very devastating blow with the death of my cousin, Paul Arthur. He was only 52 when he died rather unexpectedly. He's a beloved father of four, three boys and a girl, and a dear husband to Gladys, whom he married 22 years ago. He is the funniest guy. He's going to be so dearly missed. He caught the coronavirus along with his whole family. The family were given instructions from the caregivers to quarantine at home for 14 days. But things changed rapidly. My cousin complained of difficulty breathing on Saturday, January 9th. The next day on Sunday, his condition started to worsen, and his wife called the emergency response team ambulance several times. The ambulance did not respond right away until after 2 hours when it showed up at their home. Upon arrival of the ambulance at the family's residence, my cousin had already passed away. Sorry, this is very difficult.
Take your time. I'm so sorry, Mommy.
He died at home right in front of the young kids, in front of his whole family. What could have gone wrong? What if the ambulance had responded right away? We know that COVID-19 continues to affect African Americans as well as other minority communities disproportionately. We know that the pandemic has further revealed existing inequalities in healthcare. Men and women in the Black community are 4 times likely to die from COVID. Though this is a complicated issue and the reason for this disparity needs to be researched further. Why? Why are Black people and minority ethnic groups disproportionately dying of the virus? One sure thing that I know is because of their ethnicity and the social inequalities and structural discrimination. I know that for sure. My cousin's wife shared that he had high blood pressure, but he did not want to go to the doctors because he felt they wouldn't take good care of him. Sometimes after he's done his labs, they never even call him to share the results with him. And so they never trusted the healthcare system. They didn't feel respected. Joel and Rachel, Black people continue to be mistreated. We know when we have been mistreated, it's time to talk about these experiences with our friends, with our relatives, and to compare their experiences with our own and to make change where we can. Many of us have tolerated substandard care and second-class treatment. And now it's time for us to seek a safe place where we can talk about these things. So to start things off, I'm going to invite you both, Rachel, you the physician, and Joel, you the second year medical student, answer some of my questions for me. Why are there racial disparities and inequities? And why are Black people suffering so much with COVID-19?
Coming back to Uncle Paul, coming back to our family and recognizing that unfortunately this has impacted us, it makes me more passionate to be a provider who will commit herself to being equitable at all levels, recognizing that I am also part of a system, that I have a lot of work to do on myself, that I can lead my colleagues to do work for themselves so that we can make sure that we take care of our patients well. So that somehow when there is another Uncle Paul, they don't feel the need to say, I don't want to go to the hospital because I don't trust the system.
I think Uncle Paul's story hits on everything we've talked about. It hits on the mistrust of the medical community. Hits on the need for more medical education for future physicians. It hits on the importance of providers being advocates for their patients, and not kind of staying on the sidelines, but taking a bigger step and doing more. The thing I love about medicine is it humanizes everyone. That when moments like these hit, you have to reflect, you have to think, and you have to figure out what went wrong and how do we improve from here.
Paul Arthur's name will be linked forever to our family, that it was the turning point for us to seriously do something about disparities, inequities in healthcare. Keep pushing and be a role model to others to bring others into the field of medicine.